You think you're getting a grip on feeling better and then something happens and you have a setback.
Lesley's not counted as one of the official coronavirus statistics. She had symptoms back in March, before testing was ramped up. After resting and isolating, she thought she'd recovered, but she was wrong.
I ended up doing too much and set myself right back and had 5 weeks of recovery where I barely moved. I can do Zoom calls and I can chat to people sitting down, but if I walk up the stairs to my daughter's bedroom, I literally have to sit down and rest before I can do anything. And I think there's possibly an assumption that it's a post-viral illness and we'll get better if we rest, but we know that it's more complicated than that, and we know that post-viral illness itself is a difficult thing to deal with.
New research published over the past week backs that up. Lesley's part of an online support group which is calling for a national response. It's being backed by Chest, Heart and Stroke Scotland.
Symptoms of long COVID cut across a number of different health disciplines. So we mustn't silo people. We must put together what we call multidisciplinary teams, people who've got the skills and the understanding to see the person as a whole person and not just a set of health symptoms, but actually the impact that it's having on their whole life. And that's why a national service for long COVID is so important.
Today, Scotland's Chief Nursing Officer insisted there was a framework in place, with the temporary Louisa Jordan Hospital being used for additional physiotherapy appointments.
From a mental health perspective, some people are struggling, and we have invested in mental health services over recent months as a consequence of that. Our occupational therapists are working out of GP surgeries. A range of services are available for people, and we would encourage those who are suffering from what they think is long COVID but certainly haven't recovered as quickly as they can from COVID to contact the primary care services.
But for those still living with symptoms, that advice is of little comfort. They want their experiences to shape services.
We stayed at home still breathing, but sometimes barely. People had quite traumatic experiences. We felt missed out of the narrative, and it felt like we were a group of invisible people. While we've got this space before the virus potentially gets out of hand again, we need to do something about the chronic illness.
It's a sobering reminder of the dangers of this virus. Kay Nicholson, STV News.